Good evening. My name is Jonathan Audu. Welcome to my signature assignment for NURU 645. On this signature assignment, I will be talking about the clinical site where I did my training and also the patients I came in contact with and how my perception have changed towards this patient being a psychiatric nurse provider and not just a registered nurse or a family practice provider. The clinical training was done in two segments. The first segment being NUR 643 and the second segment being NUR 645. And they were both done at the same facility called Victoria Care Medical Group. It started during the pandemic. My clinical practice was done at the same outpatient clinic, and I also had the opportunity to perform psychotherapy treatment through the knowledge I got from both preceptor, Dr. Ezeokoye Kalista, and also Dr. Gill, being my instructor from Bradman University. It was a learning experience. It was exciting. With Dr. Kalista, I had the opportunity to witness patients with anger management involving parenting, family counseling, domestic abuse, and other related issues. This training have made me understand that I could actually treat a patient using psychotherapy rather than using medication. Using psychotherapy like cognitive behavior therapy, mindfulness, family therapy, and other good ones. This way, the patient will see things in a different perspective and also know they could also get treatment via non-pharmacological effect. I also saw patients with medication non-compliance, and some of these patients have also violated court order, and they do not have the right to self-decision. Some of the children that were seen were from foster home, and they are in custody of another family member. Medication management was also a focus as I learned from my preceptor the importance of patients to be medication compliant. Um, the clinical site comprises of various medical team, uh, Dr. Kalista being a psychiatric nurse practitioner. They also have medical doctors. Some of them were family practice and also a psychiatric medical doctor, and also a family nurse practitioner also. They had medical assistants, which helps in like things like vital sign and other things that are within their scope of practice. Um, During the training, I learned that data collection, it's a very important aspect of this training, because when we get the required information during assessment and interviewing, it will help foster the kind of care and treatment a particular patient will receive. Um, at first, I wasn't going to lie, it wasn't a good starting experience because it did happen during the start of the pandemic, and securing a clinical site was a kind of a difficulty. But immediately I was able to gain a slot. Um, it was a very good experience. Um, It was a success trying to gather psychological information, but was stressful at the beginning from some patient that believe they do not need to give me any information if they choose not to give me, and they are not obligated to answer any of my questions. But as the conversation goes by, such patients begin to develop my trust, and collecting information from this patient became a little bit more easier for me, and it became an easy task to go with. Um, there was a similar case also like that, whereby a patient was thinking people were talking about her because she lost her job, and she was in the midst of eviction. Um, I wasn't able to get into her from the beginning, but later on she let loose, and I was able to obtain some vital information, and made a conclusion doing differential diagnosis that this patient was suffering from anxiety attack. Um, I didn't prescribe any medication for her. I only scheduled her for psychotherapy, which really went a long way, and her symptoms improved a great way. Um, One other aspect of this training was the importance of billing, because I got to understand that using the right billing code is very, very important, because when we bill, we try not to overbill, and we also try not to underbill. Um, there are different codes for different visits and different procedures. Some codes for visits were the 99213, 99212, or 99214. Um, Also, in general, um, I believe I have gained quality experience in this facility and the school as a whole, meaning the Brandman University training. And I believe I've been prepared sincerely to make me feel comfortable in starting this practice as a psychiatric nurse practitioner. And also, I'm ready for the mental health population, especially the underserved community. Um, my perception towards this patient have been in the difference right now. I now know that if this patient could do the things they're asking us to do for them, they wouldn't need our help. So we should count ourselves privileged and lucky to be among the few that are serving this community, and we should be proud of it. Overall, it has been an interesting journey being in this program, and leading to my final phase of the training, which is my scholarly project, and I pray that I'll be able to come out victoriously. Thank you very much.